The state of Texas 10-year budget impact of this, and this is the subject of great debate, but the CBO, who is, ought to get an Oscar this year, they've gotten more press than anybody else. The CBO has certified this number. It's wrong. It's not right. And so they're saying it's $1.4 billion over the 10-year period. Health and Human Services, as John said, I think John quoted 20 to 21 billion. My number that I picked up was 24.3 billion. Those are wrong. And you're going to hear a lot of this discussion about how this is co-opting the state budget, which it is, and it's co-opting every other state budget, and it's going to have big impacts. I think the point is that these numbers are big. They will have significant impact on businesses and individuals, not just policymakers and not just politicians, but on us. The DISH reduction, I don't want to get overly technical, but there's a part of the way that these uninsured have been taken care of is if you think about what the state and the feds have done, they pay hospitals some amount to recognize their obligation to take care of all these people in Texas, for example, 6 million people that don't have insurance in their emergency rooms, and that's called disproportionate share income. We call it DISH. The feds are sweeping totally $36 billion of DISH payments to hospitals across the country. The share in Texas is about $1.2 billion. Now, hospital administrators, being really bright people, said, well, you're taking money away from us. We don't like that. Tell us, but you're going to cover other people, and so when these people show up in our emergency rooms downstream, they're going to have coverage, and so, over some period of time, that deal works out, and it's a much more rational system. That was the logic around why the hospital industry essentially agreed to support this reform legislation. Texas Health and Human Services estimates the cost to be much higher, $24 billion. It's interesting that Health and Human Services in Texas forecast from 2010 to 2023, the life of the legislation ends in 2019 and has to be reauthorized by Congress. It only has a 10-year life. So they've already assumed that it's going to be, the law of the land for the next decade as well. They're likely right in that regard, but their estimates are likewise, in my view, wrong. The feds pay all new costs of this legislation to the states until 2017. It costs the states not one dime until 2017, and between 2017 and 2020, it steps down from 7% the next year to 8% cost sharing, and ultimately the state responsibility will be 10% of the marginal cost of these new, largely Medicaid enrollees. That's the way this deal works. That's what scares us all, is that the only way these numbers hold is if the elected officials in Washington, D.C. have the discipline to make the assumptions upon which this legislation was predicated become a reality when the individual points begin moving around and changing. I don't know about you, but I've never seen a case where, in the face of any kind of conflict or any kind of choppy waters, that politicians can make good decisions about what their previous promises had held. The only sure thing is that the numbers and outcomes that we're talking about that have been preached and have been sold in this deal, they're going to be different. I don't know what the numbers are going to be. I've showed you numbers that say it's going to cost the state of Texas $1.4 billion over the next 10 years. I've showed you numbers that say it's going to cost $24 billion over the next 10 years. The best thing I could tell you is it's going to cost probably more than $1.4 billion in less than 24. And I think that's all anybody can say at this point. Now, here's some implications for you that I think are very important. This will have immediate impact on you as an employer. despite the fact that the mandates on you to provide insurance for your employees and the employee individual mandates don't become active until January of 2014. January 2014 is sort of D-Day. The implications for the insurance company are immediate upon enactment of this law. So here's what happens in my estimation. There's four things that are going to be supportive, five actions that are going to be dynamics affecting premiums. The first is that we have 32 million Americans that will now be covered in some form. 16 million in Medicaid, 16 million on the commercial rolls. That's a good thing, and that will largely serve to put downward pressure on premiums. Because in the state of Texas, if you look at your premium, what you pay today for you and your family, anywhere from 35 to 40% of that premium is there to cover the people, the 6 million people in Texas that don't have insurance. That's sort of the cost shift, where the providers raise their rates and pass it back through to the insurance companies, and they come back and jack your rates up by 39% and all those kind of things. So if you look at, for every $1,000, $300 to $400 of that dollar in premium is representative of that cost shift. Adding more people to insurance will, over time, put downward pressure on the premiums in that regard. Now, before you begin celebrating, the insurance companies will have excise taxes on their premiums. It will take them probably 18 months, but they will fully pass those through to you, the consumer, and to me, the consumer. That's going to be inflationary. The insurance companies are going to be required to maintain an 85% medical loss ratio, which is essentially the percentage of their premiums that they have to pay out in medical claims, leaving them 15% for administration and profit. You see some insurance companies all over the board in that regard, but today, if you're running at 82% medical loss ratio, you will be taxed at the end of the year to essentially buy an amount, by the difference between an 82% MLR and an 85% MLR. They will also pass that cost on through to you, the consumer. And finally, that MLR requirement, I believe, is very, very important because it's going to serve, I think, to wring out all of these little niche insurance companies that provide supplemental policies and intensive care policies and so-called catastrophic policies, where they're frequently surfing on 35 and 40% MLRs and 55 and 65% essentially profit. They're going to be held to the same standard. It's going to drive them down, and I think further consolidate the insurance companies into the Uniteds of the world, the Aetnas of the world, the Cignas, the Blue Crosses, sort of the big behemoths in the industry. Whenever you see a contraction of the number of people selling a product, that's never good for prices. So I think that will be also rather inflationary for you.